We need to raise the issue of stigma because for many patients, it's the fear of unknown even before they walk through our doors.
I remember getting diagnosed with hepatitis C, and when I went to go get a FibroScan, I was asked on just the intake paperwork, how I'd acquired it. So by, the non-blaming methods like getting it through a blood transfusion, but because I was an injecting drug user, I was really frightened because I thought I'd end up getting treated really differently and, just worse than everybody else just because I inject drugs. And it really made me lose confidence in actually, seeking treatment for my Hep C.
If we think about the person who's using alcohol or other drugs, they're carrying that stigma on their shoulders. It's a really heavy burden, and sometimes I think it's actually even more harmful than the alcohol or other drugs that they're using.
I just felt really gross and felt like they were looking at me differently to everyone else.
A lot of the healthcare is actually linked to AOD, so women are twice as likely to get cervical cancer if they've used substances. 90% of cases of Hep C come from IVDU. 40% of heart attacks in people under 40 are from stimulant use. Diabetes is heavily linked to alcohol, just like cancer is. But even within these sectors, we don't look at AOD within those sectors. We see it as a separate problem. So we're not addressing the person as a whole and all the changes that can happen.
We need to raise the issue of stigma because a system without stigma encourages inclusivity and participation. If I could change one thing with the health system is that I would like to see more focus on integrated care rather than discrete and disparate funding or focus on segregated care.
It wasn't relevant to the current procedure that I was getting done. So I think if they just sort of said, welcome, let's do your FibroScan and, we can chat about things after, I think I would have felt a lot more comfortable and I would have trusted the process a lot more.
Perhaps look beyond the alcohol and other drugs and start to look at the person themselves. We'll see that there is a lot of things that we can do in terms of harm minimisation, in terms of treatments that we can offer, that once we've built that trust and rapport, can really make a difference in someone's life.
My role as a practice manager is to help create systems and procedures for patients, reception and doctors. It helps health professionals look into creating a safe space for patients to open up and have honest conversations.
To help put clients at ease, a lot of the times it's just listening to them. It's recognizing that this is why they're actually presenting this way. When you start to listen to them and you explain your processes and just go, okay, so what are your goals? Let's go through what you want to achieve. Let's try and help you achieve that, or help them set the goals. The majority of the times they then know that you're working with them.
I'd like to tell healthcare providers that are reluctant to provide healthcare services to people who use alcohol and other drugs that we're just like everybody else. We have our challenges, we have, differing levels of health or mental health, and that we're actually deserving of the same healthcare and support as anyone else in our community. So make us feel welcome and treat us with respect, and, we'll go the journey with you and get better health outcomes for ourselves. And you'll enjoy it better too.